we do have to pay attention to what the long-term effects COVID will have on nurses and other healthcare workers.
When it comes to COVID-19, nurses have been on the front lines from the beginning. And as they work around the clock to keep people safe, it seems their mental health has taken a serious hit.
Nurses were already struggling under significant workloads. They were working an enormous amount of overtime in order to keep the system afloat.
And then came the pandemic, adding an overwhelming level of stress. A new survey from UBC and the BC Nurses Union shows 41% of nurses suffered from anxiety and depression at the height of the pandemic, 10% more than last year.
Equivalent to about 5,000 additional nurses meeting the criteria for these mental health problems within the span of 6 months.
3 out of 5 nurses reported feeling emotional exhaustion.
They were very fearful of contracting COVID themselves and fearful of taking it home to their family, their friends, their loved ones, and out into the community.
Half of the 3,600 nurses who took part in the survey say their workplaces are understaffed. The NDP promised to add more nurses to the healthcare system earlier this month before calling a snap election.
We ask our elected or those people who are seeking election what they will do to support healthcare in this province.
With COVID cases trending upward, there's no end to the pandemic in sight. Nurses will continue to play a critical role in the months ahead. Researchers say preventing burnout will be a team effort.
Policymakers, health employers, the BC Nurses Union, the frontline nurses, and even the patients, everybody working together to develop an effective and efficient pandemic management plan.
We also need to look at investments in mental health support for healthcare workers, specifically for nurses, as they face this pandemic.
In Vancouver, Travis Prasad, City News.